Before we commence providing the bath to our patients and choosing the right linen, as well as supplies that we need for this process, we must wash our hands. Test the temperature of the water. So, wash our hands. We must wash for about 15 seconds, both sides. Clean our nails. This is a linen card, and we're going to actually choose our supplies. A towel, blanket, new gown, a cloth. It's important to consider a few key factors on this: patient safety, patient's comfort, patient's privacy, and keeping yourself in a good positioning that you will not be injured as a caregiver when providing this patient's bath. Here's our patient, and we must consider also the patient's safety when we're giving the bath, and we go from one side to the other side. We must raise the bed bar, and also we should raise the bed or place the patient on an angle that is good for the patient and also good for you as a caregiver that is providing the service. The bed table, the overhead table, should be moved towards the feet and be sure that it's at a high level. Also, raising the patient's head or the upper part of the body, it will be at a level of 30 degrees or lower. And the reason why is to be sure that it's not going to develop any sores, any back sores. Also, if the patient is on a pump or the patient is on a feeding tube, it is really important that before you place the patient on a flat position, you turn off the pump to prevent any aspiration when providing this procedure, which is the patient's bath. We do have bassinet with a warm water. We also have a soap. We have our gloves, our cloth, towels, to dry the patient and also to provide the bath. A clean gown with a fitted sheet and also a flat sheet and a new blanket to cover our patient. One of the first steps that we're going to do is to provide the patient's privacy. By closing the curtain, be sure that there's, like I said before, there's no anyone around in order to provide the patient's privacy. First, we're going to introduce ourselves as the provider, and we're going to tell the patient who we are and what we're planning to do. We are going to we're going to provide you a bath, and we must check the patient's wristband, and we will ask the patient their date of birth and their name, and compare that to the wristband, and be sure that we're actually treating the right patient. Be sure that you identify that there's no pump, there's the IVs, everything that is connected to the patient, that you consider that when providing the services. Now that we know that this is the right patient, we're going to begin by raising the patient's bed. Like I say, we're gonna raise in about 30 or under, and then we're also going to raise the patient's bed just to avoid us getting injured, any back injury. We must lower the bar and keeping ourselves here close to the patient but not touching the bed. The way we actually prepare the cloth is by turning this way, and this is how you actually prepare to provide the patient's bath. We're going to commence by actually providing cleaning the patient's face. First, we're going to get this wet, no soap on the patient's face. We must wet it, and we're going to clean the eyes outward. We're going to go this way. First, we're going to do the eyes, then we're going to clean the rest of the face, cleaning also right behind the ears. Remember, not to use any soap on the patient's face. It will be just water, and be sure the temperature of the water is warm and that the patient feels comfortable using this. Now we're going to wash the patient's upper extremities as well as the chest area. First, we're going to remove the gown, always keeping patient comfortable. We're going to commence by doing the patient's upper extremity. We will place a towel right under their arm. We'll break some soap, and gently we're going to clean our patient. Then we're going to rinse it, and we must clean the patient. We'll pat dry with the towel that we actually place. Be sure that the patient is dry and you don't leave any soap on the patient's body. We will raise the bar, and we will switch to the other side, to the other extremity. For demonstration purpose, we're going to clean the chest, and we're going to avoid the other extremity at this point. What we'll do is we will take off the gown completely from both sides. We will place the soap, and we will begin by cleaning the body, just the chest. Eliminating and cleaning the soap out of the patient's body. And then you take the other towel, you pat dry the patient. Once your patient is dry, then you will place a new gown before moving into the lower extremity. You are not going to tie the patient's back just because you still need to wash their back and move them into the side in order to wash the back. Now that we finished providing bath to the upper extremity and to the chest, we raise our bar for patient safety, and we're going to move into the lower extremity. We provide the patient's privacy by removing the blanket and making the patient comfortable, lowering the new gown, exposing the lower extremity. We're going to place a towel under our patient's lower extremity, rinse some soap on it. We will gently cleanse our patient's legs from the upper part to the lower part of the body. And at the same time, we're going to be assessing the patient for any sores or any lesions, any skin abrasions. We be sure that we're doing an assessment at the same time that we're providing the patient's bath. Be gentle when you get to the end. You clean between the toes and assess for any changes in the skin or any skin breakdown. You rinse the soap and pat dry with the same towel that you have. Once it's clean, you remove the towels, lower the gown. Be sure at all times that your patient is comfortable, that the patient is feeling good. Ask the patient questions, how's the temperature of the water? How do you feel? Am I being hard on you? Everything is okay? Just be sure that during the whole process, the patient is comfortable with you. Now, we should do this next as the other side, but for this demonstration, we're only going to do one side, and then we're going to turn the patient to do the back care. Now that we have our patient turned, you should keep the patient in this position. Have the patient's arm or hand holding into the bar. Provide a good comfort to the patient's head by providing a support pillow. And also, be sure that the patient is covered at all times. Place a towel close to the patient's body. Place some soap on it. We must assess the patient for any skin breakdown. We must assess for any pressure ulcer, especially in the sacrum area. If you don't feel comfortable having this bar here, you can always lower it, but you can always keep it. For safety purpose, you can always keep it there and avoid, just in case that the patient fall back. Once we do that, then we're going to rinse the soap, and gentle, we're going to rinse the soap from the patient's body, and then we're going to pat dry. Be sure you cover your patient. And now we're going to go into the genital and the anal area. We're going to do it pretty much the same. We're going to wet our cloth, position it the way we're supposed to position the soap, and just clean it from front to back, switch to another area, and then the anal area with a different part. You rinse it, and then the same thing, front to back, then you pat dry, you hold the patient back into the previous position, and you tie the patient's gowns on the back. This concludes my presentation for patient's bag. I hope you enjoy it, and just remember not to keep any dirty clothes close to the patient or close to your body. Place the dirty clothes on a dirty basket. Be sure for patient safety that your bars are placed in the right position, that the patient is comfortable, that the patient feels good about the services you just finished providing.